I take care of people with chronic conditions, mainly lung and respiratory problems, and they are probably at some of the highest risks if they do get COVID infection. My name is Dr. Dennis Lawlor, one of the pulmonary and critical care physicians at Olathe Medical Center. What I would say to a patient coming in that's afraid to come in for their care is that we take every precaution to keep them safe and to keep our staff safe, and that frequently their health is going to be in more jeopardy if they don't come in for being evaluated and to get their regular routine care and assessment for preventative care. A number of my patients have higher risks for lung cancer from previous cigarette smoking and from other exposures from their workplace, and to have regular screenings to try and increase the chance that we can pick up a cancer if it's going to develop early where it's more treatable is very important. Reducing the risks of infection by immunizations for those at increased risk that have different things that make them immunocompromised are all very important. So to protect both the patients in our lobbies as well as in our office and our staff from getting COVID infection during this time, we ask each patient the day that they're coming in about symptoms that would be suggestive of infection. There's ways to try and differentiate what's an acute infection from a chronic respiratory condition, and I think our staff are very good at screening for that. Additionally, when they enter the building, they're monitored for if they're wearing a mask, and if not, one's provided. So when they're in the office themselves, they're reducing the likelihood of having droplets that would spread to either staff or other patients. Our staff themselves are screened about their symptoms and wear a mask, and depending on what types of testing and procedures, if there's more of either what they're doing about a breathing maneuver, there's additional precautions that we'll take trying to reduce the risk that they would transmit that to staff or to other patients that follow them when they get their tests. For this upcoming flu season, there's some overlap between having acute influenza and having a COVID infection. I think the most important issues are prevention and trying to keep your health in the best level that you can, your regular maintenance medications, and keeping your immunizations. The new influenza vaccination is just now coming out in this next 30 days, and having that updated is very important. I think optimistically we will get a COVID vaccination as well, and when that becomes available, that will be another important part of preventative health.